I'm really excited about this meeting. It's always a great collection of abstracts, but also we've selected some really perfect discussants for the different papers. So I think with each abstract, we're going to find a really interesting discourse between the presenters as well as the discussants that will really bring the whole audience in. I think there's two topics that are really going to be very interesting that will be great discussions amongst even our adult and thoracic colleagues. The first one is a comparative analysis of two different cardioplegia solutions, Del Nido and St. Thomas, that's being used widely in both the adult and pediatric worlds, but has fairly different indications. And I think that'll be a really lively discussion between those two subspecialties. And then there's another topic coming up, the external stenting of trachea and bronchi for children with tracheo and bronchomalacia. That can be done in several different ways, but there's a very interesting study looking at that and having also a lively discussion with our thoracic partners about how best to address this lesion.
There's a lot of new material coming out about some of the newer technology, including minimally invasive approaches to different cardiothoracic operations that are going to be the focus of a lot of the science this year. Also, a lot more attention on trying to improve processes to improve overall systems in delivery of care. I think there's an increasing focus on some of the upcoming guidelines that are coming out, and there will be a lot of excitement about the new AATS-sponsored guidelines, and surgeons attending will be able to not only hear those guidelines, but discuss how they may implement the changes in the course of their care for patients.
It's so important for the cardiac surgeons and the thoracic surgeons and also the team members to attend the 2016 AATS meeting. You got to be updated to live and survive in this new world. This is a new session that focuses on really optimizing the care, preparation before surgery, care for the patient in the operating room, how to manage things, and how to optimize care after. So this is a very important session, and we are bringing up several topics related to infections, related to management of cardiopulmonary bypass, related to management of cerebral protection, and glucose management. So several very good topics that you would like to listen to.
Well, we're going to have a full spectrum of cardiac surgery represented. So we're going to address valvular disease, we're going to address coronary disease and aortic disease, and atrial fibrillation. And there's a full spectrum of procedures that are evaluated, disease processes that are evaluated in this abstract meeting. Well, I think it's going to represent the most important and advanced knowledge that is out there for controversial topics, for lots of new innovative types of therapy, and obviously all the hot topics in adult cardiac surgery at the present time.
There's a lot of exciting new research that's being presented at this meeting, including some basic science work that may have direct application to clinical translation in the future, as well as novel applications of technology, for example, computer fluid dynamics, to decide whether or not a patient should have some very complex operation, complex surgery, which is extremely exciting. Beyond the fellowship, which I cherish greatly, I think it's really exciting to hear some of the novel groundbreaking work that folks are doing, and it's exciting to see the evolution of our practice in real time. It's like going to a great convention or a great concert where you get to be in front row to see some of your greatest stars presenting the latest technologies, latest advances in the field, and that's extremely exciting to be there.
This meeting is a great opportunity to not only learn from the people presenting, but to give your opinion as well. We would love to hear about the experience, especially from people outside the United States, with their new technology and their own approaches. Almost the entire program is a can't-miss program. There's a lot of new technology and a lot of new applications of new technology. So I've personally already changed my practice based on the abstracts I've seen. I'm sure anyone who attends will do the same.
AATS Week 2016, the AATS Aortic Symposium in New York, and the 96th Annual Meeting in Baltimore.